About 1976, I had a patient came to me and wanted facial feminization who was transgender. Her biggest problem was her voice. Her voice was very male. And at the time I went to someone, because I had an idea of something that might work, and I went to what I considered one of the best laryngologists with the most experience in the country, and I told him what I thought, and he said, no, that won't work. And my patient said, you know, I don't care what he says. I'd be willing to try. I would pay you, and I'll sign whatever you want, and let's try it. And so we did, and it worked beyond my wildest dream. And it turns out that worked in about 90% of patients. And some patients who'd had previous trach shaves, it was only like 50-60%. So that I developed ways of making it more reliable, because some of the early patients, the voice would be really good, and over the next 2 months it would drop off again. So we've corrected that problem. We don't operate on the vocal cords or any other thing that would cause a bad voice with that procedure, the voice modification procedure. We've had 0 complications. That means no bleeding, no scarring, no airway problem, and the only negative is 10% of the patients, it doesn't work.